Can you imagine a baby being born addicted to drugs? While the thought may be disturbing, this is more common in society than people think. As time passes, we have more cases of addicted newborns. The mother and the child are connected through the placenta. When the mother abuses drugs, the baby feels them too. The higher intake of drugs during pregnancy, the higher the chance of the baby being born addicted.
Prenatal care is crucial in pregnancy. Abusing drugs affects the unborn child and makes them addicts as well. Most babies are born underweight with developmental problems and many times as drug babies, addicted to the same drug the mother used during pregnancy.
The risk of stillbirth and miscarriage from substance use in pregnancy varies depending on the substance. According to drugabuse.gov, those who use marijuana and opioids have a 2.3 times greater risk of having a stillbirth, whereas tobacco also plays a fundamental role in developing these complications.
The type of drug consumed during pregnancy and the amount a mother intakes has a lot to do on how it will affect the baby. There are major cases in which mothers have used drugs during their whole pregnancy and they have a very perfect, healthy baby. But with time, we begin to see the effects that the baby didn't have while being born, which include psychological, they include learning disabilities, they become hyperactive children. These are a lot of common factors that we see in society today.
It is a crisis. It is epidemic. The opioid crisis in this country is continuing to expand exponentially, and we're seeing more and more of these infants.
I was in labor, in the bathroom shooting heroin, about to give birth to my child.
The fact that the baby is born addicted to drugs should be a big red flashing light that says, danger, let's all take a look at this child and its mother and its family and its residents and see if it's safe.
You're so clouded when you're using, and when you're an addict, you think everything you're doing is okay.
I met my best friend about 11 years ago in 9th grade. We were in high school together. At the age of 17, she became pregnant. At the age of 15, she began using crystal meth. It was hard for her to stop. We stopped hanging out for some time, and when we clicked again, she was about 8 months pregnant. She confessed to me that she was still smoking crystal meth, and I was very astonished to see her abuse drugs being so far in her pregnancy. I became pregnant at 16, and my life changed as soon as I found out I was pregnant. So for her to harm the baby and know what she was doing was very devastating to me. When her baby was born, she was born at 36 weeks, which is 4 weeks earlier than the normal 40-week term. Her baby now is about 5 years old. She has a learning disability. She learns at a smaller pace than the rest of her kids at that age. She was born preterm. She's about 5 pounds when she was born. And until this day, my friend regrets what she did. Even though her daughter was immediately taken away at the hospital at a Long Beach Memorial, she was able to get her daughter back by staying clean. But the long-term effects that drugs cause on a pregnant, on a fetus, can be devastating. So please, if you know anybody who's doing drugs, do the best you can to help them and guide them in the best path possible. Yeah, thank you.